Great, thanks, Sarah. Look, today's really comparing the ISO international standard and the Australian Model Code of Practice, noting that there's a couple of different codes of practice out there in each jurisdiction, and there's also some new regulatory requirements that is either commenced or are about to kickstart in different states. So along with comparing those documents, we'll also touch on the identification of psychosocial hazards as well, with the understanding that there'll be 3 more supporting webinars that will go through the implementation of how to manage psychosocial risk. So moving right along, just a quick thing about our organisation, FEFO Consulting. We've got consultants in most capital cities across Australia, working across Australia and New Zealand predominantly. We've also got a registered psychologist, given the topic today, Marina. So Marina chimes in and helps us interpret results and facilitates many of our workshops. It's also worth mentioning that our health and safety index tool, through demand, we've also developed some psychosocial DX surveys too, which we can talk about a little bit later today if we've got time.
Okay, we're going to start, Sarah, with a quick poll, if that's okay. So what we're trying to get is some feedback from everybody on the line, and really we're looking to understand, select 1 or more options below that your organisation has adopted effectively to manage psychosocial risk. So if you can select 1 or more, but really your management systems and aligning those processes to 45,003, any sort of active or tactical risk management processes you've got in place, climate surveys, incident management, or informal basic ad hoc approach. So while that's sort of happening, I think important to note a couple of things as we've planned for this session today is, I guess, the spelling of psychosocial risk. We could have put that in as a question as well, is can everybody spell it? Because I know we found it quite tricky how many times we've had to spell it there. But I think important to note as we're sort of capturing that feedback is, I read something recently, and it was actually psychosocial risk isn't actually about trying to fix people's problems at work, but actually supporting their needs whilst they're at work and making work a protective control rather than a supportive factor rather than a risk to that person. And I think with that in mind, it kind of sets the tone of the why we're here today, and we're going to talk about some of the tools that can help that along the way. So poll results.
So as you've been talking there, Beck, there's a couple of chats going through just mentioning that we can only select 1 today. So I guess for those people in the call, perhaps select the most, I guess, primary option that you've been implementing with your organisation to date.
Okay.
Yes, Mark, I think that was my problem in setting up the poll incorrectly. So yeah, I just said they could probably put some of the options in the chat as well if they wanted to.
Yeah, great.
I guess with that in mind too, we'll grab the results, but if there are any questions, please feel free to put in the Q&A or the chat, and we'll monitor it throughout the next 30 odd minutes. So that's interesting feedback, Mark. When we sort of talked about this poll, we were looking, I had my money on the informal basic ad hoc approach, because I think a lot of businesses I'm seeing, it's just not quite sure how to attack it. It's not like a traditional 45,001 management system. So, and risk management, doing risk assessments. Are you seeing anything there, Mark, that's out of the ordinary?
I actually suspected the ISO standards, the approach around integrating into existing systems to be a little bit higher.
Okay.
But that's okay. I guess we can talk through those different options today with the understanding that there's no one right way. There's lots of options, of course, of how to do it.
Okay.
So moving right along then. So I guess, as mentioned, this is a 4-part series. We're focusing on psychosocial factors today. And Beck was making fun of me as we're practicing the webinar that I've actually arranged the webinars in reverse order, with the understanding that the other webinars will be focusing on change management, opening up conversations, and lastly, just looking at different roles of health and safety versus HR. Often there's a bit of confusion around who owns what, so Beck and Joanna both work together actually in their respective roles across HR and safety, so that should be a really interesting webinar as well.
I think it's important to note, as Mark, you go into the next slide, is that going through the process and actually engaging specialists along the way is really key, as this is sort of an emerging area that safety professionals are now having to manage. So that's why we've got some partners that we're partnering with throughout the series. Yeah,
no, that's a really good point, Beck. So I guess moving on then to today, with the focus on psychosocial risk and comparing some of the publications that are out there, often we're asked where to start. So in terms of understanding psychosocial risk, I think it's worth understanding where you are today versus where you want to be. But also, there is a big difference between understanding strategic risk around broader organisational factors and how that ties into longer term strategy, and also the here and now around more tactical operational risk as well. Beck, from your experience, have you seen much difference between these two types of risk?
I think there's a balance when you get to these two areas, strategic risk being the long-term, based on data, based on trends, aligned with the business cycle and the operational needs of where you're going, and overlaying that psychosocial plan or your health and wellbeing plan, whatever that strategic direction looks like. So actually operational risk, and I dare say a lot of the feedback in the poll was aligned with this, is actually understanding what the event is that may happen in your workplace, then working back, what are we going to do to prevent that from happening? And then looking at what you're going to do to respond if that event does occur. So very tactical approach versus that strategic long term. I think there's a balance at the moment of people finding how to actually nut through that operational risk assessment and what value you get out of that versus where you're going strategically in this space.
Yeah, good point. And I guess today we'll focus a little bit more on the strategic approach and a few considerations and how that might tie back into the ISO standards and model code. So with that in mind, given that the topic of today, I guess broadly speaking, looking at those two documents, the ISO standard being an international standard versus an Australian-based standard, apart from its geographical focus, is the ISO standard generally is considered to be a little bit more technical, and it's structured in a way to align with the ISO standard for 45001 around management systems. The topics, the psychosocial hazards and various factors are very similar to the model code of practice. I guess the model code of practice is a bit more of a practical document and focuses and is structured more around those risk management principles around identifying hazards, assessing them and controlling them, etc. So depending on what you're trying to achieve, of course, you can use either or. And today, apart from looking at the structure, we'll sort of delve into a little bit more around, I guess, some of the content too and how they might differ too. So if we go that next layer down, what we've got here, apart from comparing those two documents, is the job demands, job resource, worker outcome model. Now that model is not something that we've dreamt up. It's based on a bunch of research and typical principles around if there's a mismatch between job demands and resources, well, there's often a positive or negative impact on workers. So if we just take the worker outcomes just as an example, the ISO standard has a much greater focus on job satisfaction, employee engagement and productivity. So if you think, depending on how your job resources and demands are being managed, that has some sort of impact on workers' productivity, engagement, etc. generally. And also it focuses a little bit more on poor behaviours such as the substance misuse. Conversely, apart from the way it's structured and the general practical approach of the code of practice, it focuses a little bit more on burnout. So the principles are largely the same. Some of the content is somewhat different. We do have a downloadable that we'll share towards the end of the session today with a complete list of psychosocial factors. These are just some examples in each of the codes.
We've got a couple of questions, but I think, Sarah, is the chat enabled. And one of the questions is about the people at work survey, Mark. So we might just keep that one for the back end, because I know we've had some experience in utilising that as a tool. So certainly, I think the answer is yes, it is a tool to help inform where you're at as a business.
Yeah, 100%. Yep. So we'll talk about a little bit about the hazard identification process in a moment, survey being a really good option to do that. Alrighty, so with that in mind, we'll kick on. So noting that we've got these publications out here that have got a list of various hazards, some got a greater focus than others. Now, what do you actually do with that? Beck quite clearly differentiated between strategic and operational risk, focusing on particular events. If we look more broadly, one approach is to look at a range of different factors, take into consideration where your organisation's at. So be it reviewing data, reviewing systems, engaging your workforce to better understand how they're thinking and feeling is obviously a great way to identify some of these hazards. It's fair to say that psychosocial risk is generally invisible. So to really understand psychosocial risk, you need to ask feedback from your workforce. And as mentioned, different survey tools are a great way to do that. Certainly not the only way, but one great way to get feedback at scale.
I think when you're identifying, Mark, the psychosocial hazards as your business, one of the things that's important to do is actually understand where you're at as a business as well. So there'd be, and those, I guess, job demands that then come through on your onto your people, but being realistic about where your business is at, because there's a balance of actually going, I guess, full assessment, full strategic planning versus actually just getting out and talking to your people to understand what your workforce is feeling and and what's actually happening.
Yeah, I mean, some simple things are just having that as an agenda item as part of your committee or consultation arrangement, just as a starting point. I also think it's fair to say that this is a qualitative risk assessment usually, so it is quite difficult to quantify. So, some people try and tie themselves into not to try and measure and quantify everything. Really, the engagement with your workforce is absolutely critical to really understand that. So, understanding not only the people, but the data, processes, plan, and workplace environment, and other things that impact on those job demands and resources. So with that in mind, assuming that there's some method of identifying the hazard, either through survey or some sort of engagement with your workforce, and having some sort of, typical list of those factors as a guide, understanding those risks either through the potential impact, the likelihood or exposures is often really important. And depending on how deep you want to take that, particularly with survey, it's a great way to really unpack, well, where are those psychosocial hazards? What are the risks across different age groups, genders, positions, etc., or various demographics within your particular organisation, which hopefully will then inform some sort of strategic choice and resource allocation to manage those risks. You'll see down the bottom there's a bit of a continuum there of health, from responding where people might be struggling or exposed to trauma, prevention through to promotion and thriving. So, depending on the hazards and depending on some of those strategic choices, you can start to focus your time and resources in different areas across your business.
Okay.
So just in response to the question around the People at Work survey, the People at Work survey, for those that don't know, is a survey that's supported by some of the regulatory bodies out there. We've also developed a survey which isn't quite as long as the People at Work survey. I think that's about 100 questions, depending on how you apply it. We've got some other tools as well, the Health and Safety Index, which covers both health and safety, Wellbeing DX, and more specifically, the Psychosocial DX, which is focused purely on psychosocial factors. And in doing that, we use that data to help organisations get feedback and scale and identify some of those hazards. Beck, I know you've had a bit of experience around using this survey, both with us as a consultant, but also in your previous organisation. Is there anything else that you wanted to add to this?
I think probably, I mean, the Health and Safety Index for those that have joined has been around for a number of years, and as that's built out, maybe just describing the differences between the two DX tools that we've recently developed, and some examples of what you might capture from the independent Psychosocial DX.
Yeah, good point. So the Wellbeing DX is focused on typical health sources such as physical health, mental health, social and cognitive health, a lot of which are mentioned in the ISO standard, whereas the Psychosocial DX is focused purely on psychosocial factors, so a little bit more specific. And what we've done is structured the survey and the inputs to be very similar to those hazards that we've spoken about already around job demands, job resources, and aligned it with the ISO standard 45003. So people can get a bit of an understanding of where they're at and use that in conjunction with other ways to identify hazards as well.
I think I'll probably just call out, Mark, on each of the slides, you can see to the top left of this one, it really is like a little model to be able to capture your assessment. And this forms the middle part, which is the survey analysis, which giving data obviously helps then inform your strategy and invest your funds and your focus in the right areas that are going to give the greatest impact to your people. So this is the sort of middle one. So if you read through, it goes data review, systems review, survey analysis, and then going into focus groups, and then implement your program and monitoring some of the improvements that you're dedicating resources to.
Yeah, great. And I think as we go through the other webinars in the coming weeks with some of our partners, I'll talk a little bit more around the execution. And different, I guess, human-centered approaches to this. I mean, this is very data and systems focused today. Gotcha for Life and Levant will talk a little bit more around how to engage your people around the implementation.
Mark, so we've just got a question. The Psychosocial DX, is that similar to the Psychosocial Safety Climate Measure?
I'm actually not overly familiar with the Psychosocial measure that you just referred to, but if you want to put something in the chat, more than happy to have a look at that too. So I guess today is pretty short. It's a 30-minute micro session, so really being short and sharp. We also like to share a bit of information where people can go away and do a bit more research themselves. Referred a lot to the ISO standard already, so this pack will be shared. There'll be a link there where you can get access to that. It's also worth mentioning that the World Health Organization has recently, as last month, launched a new guideline for mental health at work. So additional resources for those that haven't seen it. And the Model Code of Practice, as we referred to as well, also recently launched. And each of the jurisdictions also have codes of practice and regs either published already or in the pipeline to be released.
I'll also just put into the, we've gone to the next slide, Mark, but I was going to say I'll pop into the chat actually the downloadable, which from the site, our website, that talks about just the differences, and it's actually for safety professionals. It's a really good call out of each of the psychosocial factors between the ISO 45003, which we've sort of talked about at a high level today, versus I guess the practical guidance in the Code of Practice. I've certainly found it to be, when you have a read of it, far more practical in terms of how do I actually now manage this risk, and as a safety professional, pretty well aligned with a lot of the other code of practices and the approaches that you take in any other safety hazard.
Yeah, look, depending on the level of detail you want to go to in the organisation, you might just want to keep your risk registers or methods of evaluating risk at job demands and job resources, etc. But that downloadable actually goes down and categorises some of those hazards too. So you might, from a setup from your safety software, as an example, you might want to start getting some of your metadata to better break down some of those psychosocial hazards as well, so you can better understand the risk and report on those as well. Earlier on, we also mentioned our registered psychologist who worked with us, Marina. Marina is going to be delivering some mental health awareness training, a public course coming up. So we're partnered with the Institute of Quarrying Australia to deliver some of that training, and other training also in the pipeline, both the back end of this year and next. And there's also reference to the Health and Safety Index too there as well. So we have allowed a little bit of time to go through some questions. So there's been a couple of chats already, but yeah, open to any other questions that people might have around some of the things that we've spoken about today, or anything else that might be related to the topic. So one of the participants who put in the question around the psychosocial safety climate measure, I'm not sure if that's a specific title to a survey, but I guess the Psychosocial DX by default is a type of climate survey, if that helps. Mark mentioned reliability. What does this mean? So good question. So I guess regardless of whatever survey tool you use, the principles around good survey design, so you do have a solid benchmark, is ensuring that the survey is both statistically reliable and valid. Now that's really important because, I mean, anyone can develop a survey, but to actually come up with something that you can compare on with the right levels of confidence intervals across a given population size is critical to be able to make sure that the information that comes out of it is meaningful and can be benchmarked, not only internally, but externally across other organisations and industries as well.
So Mark, we've got another question, knowing that we've got about 6 minutes to go. How does one build in-house competencies to put together a strategy to tackle psychosocial risks? I guess, I don't know, my initial view on that question would be start with a top-down approach. You've got to understand from the top where you're going with managing this risk, get their buy-in. I'd start with having a read of the code of practice to give you some guidance about actually where to start, but talking to your people and getting some feedback on actually what you're trying to address. And start really basically with updating your risk register to identify your psychosocial risks and managing those. Do you want to add anything to that, Mark?
Yeah, look, I also think that often people revert to training as a solution straight away. A bit like an incident investigation. I mean, it's really important to understand what your focus areas are first. So, often awareness and knowledge is not the gap. There could be other organisational factors like job conflict or job design, different job demands and resources that are impacting on psychosocial risk or mental health. So certainly training and awareness is important and competence is important, but it's certainly not the only thing to focus on.
Sarah, for some reason I'm unable to share. I've shared the link, but it's only with you and Mark, which is not helpful for anybody else. But it doesn't look like I've got approval to share outside of with the participants.
Right. Yeah, I've shared it with everyone.
Okay, brilliant.
So yeah, I'm not sure why that is, but I think there's something wrong with all the permissions today in this webinar.
That's okay. The question, we've got a couple of minutes, we've got 5 minutes left, which is, do any of these resources have a risk assessment tool specifically for this? At the back of the code of practice, there's a fair bit of guidelines on there about what potential hazards there are and potential strategies then to look at managing them, which is probably a very good start. Anything else to add to that, Mark?
No, I think it's a really good point, with the understanding that try and leverage your existing risk management framework. So, the understanding that there are different parameters of risk that people manage, either through risk register or other more specific operational risk tools, is to try and use some of those tools you have already and integrate psychosocial factors into those, both proactively and reactively as well.
think one of the conversations I'll just repeat that we had this week, Mark, is that you were with a client and they said we need a psychosocial policy. We need a policy to deal with this now because it's an emerging risk. There's legislation that's changing in around it, so we need a policy. And I know your feedback immediately was actually, how about you just update your risk register and start with identifying what that means for your business rather than another piece of paper to address something.
Yeah, definitely. So, I mean, my question was, what's the purpose of the policy and what you want to try and get out of it, and have you actually engaged the workforce yet? So, they've skipped procedures and policy and all those sort of procedural solutions and skipped straight to engaging their workforce and updating risk registers.
Can you see that? So when a psychosocial risk assessment is done, workers feel have no confidence in answering honestly. Even though there's been mention of burnout and work demands, how does the company go about addressing this, or what should the next step be?
I can jump in there, Beck, if that helps. I mean, certainly having a third party administer a survey is one way to do that and to give people confidence that it's confidential. With the upcoming webinars, Gotcha for Life will be talking a lot around psychological safety and getting people to open up and feel vulnerable. So I think, I mean, apart from having third parties involved, by gauging trust and building trust within your organisation and helping them feel psychologically safe, often that's a really good first step before you engage in a bunch of activity. Otherwise, people sit there with their arms crossed and don't want to engage.
Okay, any other last questions? I think we've done pretty well on time. We've got 2 minutes.
So I guess we've got a bit of time. We do have some backup slides, Beck. I'll just refer to the psychosocial DX at the back so people can get a bit of an understanding of some of the things that are measured. So this is just the dashboard. We've also got a bunch of information that sits behind this to help organisations unpack that for their organisation across their specific demographics. But you can see there we've got an overall index metric. It's broken down to various dimensions, which are largely built on psychosocial factors. The aspects down the left-hand side are things like broader organisational factors, social factors, the work environment and the actual activity that might be impacting both job demands and job resources. And then, as we mentioned before, the worker outcomes, the output is, based on those behaviours, practices, work environments and all those aspects we spoke about, what's the actual impact on workers and how are they feeling around job burnout, their levels of engagement, leave intention, etc., potential pain. Often there's a relationship between injury and mental health as well. So that's just a quick snapshot for those people that might be interested. So right on time. Becca, anything else you wanted to add, Sarah?
Not at the moment. I just want to drop the link in here for the next webinar next week, and do that in a second.
I guess there's some feedback in there. Just closing remark. A great organisation sees persons working in construction industry known to have issues with suicide, and mostly men working together that may not potentially talk to each other as an organisation. They're used all the time. Are we talking, I'm assuming, mates in construction potentially? There's lots of resources out there that help open the conversation along the way.
Okay, all right. Well, if anyone has any questions, they can always come by email as well to either me or to FEFO. And otherwise, we will see you next week. We do have a webinar tomorrow as well on writing better incident reports. So I'll just put that link in here too. And just one other thing, the news now goes out on a Wednesday. So there we go. Thank you, Rebecca. Thank you, Mark. And thank you everyone for coming. It's great turnout today.
Right. Thanks, Sarah. Thanks, Beck.
Bye.